why is it that resurgeries for the retina are never as successful as the first surgery? This is Dr. Anina Abraham from Advanced Retina Care, Hyderabad. When we do a retina surgery, the very first time the vitreous inside the eye, which is the jelly inside the eye, is totally untouched. That is the time the surgeon gets the best opportunity to remove the vitreous completely. It's extremely important to induce a PVD. A PVD is a posterior vitreous detachment. So the surgeon needs to remove the vitreous in toto or completely. And this happens best in the first surgery. Once the vitreous is completely removed, it is very easy to settle the retina, remove any membranes which are on the retina in a case of a diabetic retinal detachment. So the first surgery is absolutely important. Yes, there are times where the retina redetaches and requires resurgery. But if the first surgery has been good and the vitreous has been completely removed, the second surgery follows and is not so difficult. It's very easy to settle the retina. The only issue occurs if breaks are in the inferior portion of the retina, or some PVR changes, which are some complicated changes in the retina, have already developed. However, it is important to keep in mind if it is a diabetic retinal detachment, we call it a tractional retinal detachment, the first surgery is most critical. If the retina settles well in the first surgery, normally it is settled for life. Patients keep coming after having undergone a procedure, after having undergone 2 to 3 retina surgeries, and then they come for an opinion. It's already too late most of the time, because we don't know to what extent the first surgeon has removed the vitreous, how many membranes have been removed, what was the situation intraoperatively. So it's extremely important to operate such cases right in the beginning and not a resurgery and again a resurgery. The success rate drops as the number of surgeries increase. Also, the health of the retina, blood flow to the retina, all this gets compromised once surgery is done again and again to the same retina.